cold showers last year.
Yeah.
This year I bought the plunge, and when the plunge freezes outside and I can't get in it, I fill up the bathtub upstairs with ice. But it's just an amazing life changer.
We are not designed to eat all day, every day. We evolved surviving in the African savanna, going days sometimes without food, and running hundreds of miles until we find food, we eat a lot, and then we fast again. This is how we evolved.
Do you believe a lot of humans are where they're at today because of something they've experienced in their childhood that led them to what they do? There's real issues out there that could cause real anxiety, real PTSD. Welcome to the show.
Oh, thanks for having me.
Dr. Ali, of course. The show is called Shotcast. See the S and the C?
Okay.
It's like a podcast, but we want to give a shot of inspiration, a shot of value, a shot of knowledge by the end of the show. So we don't want to just talk about anything. We want people to actually get some value out of the show. I know Dr. Ali. I call him Al. For what, 5 years now? 4 years now? Closer now than from before.
Yeah,
but,
there's some blood connection now.
Yeah. Not only is he a doctor that operates in the emergency room, mainly,
critical care, ICU.
Critical care, ICU. So thank you for your service. But also, he's a very interesting guy. He's one of the guys I actually look up to as a mentor. He's very adventurous, and he has a lot of interesting topics that we speak about. And you've taught me a lot, so I appreciate you.
Thank you.
Why don't you tell us a little bit about yourself?
Well, thanks for having me, first of all. I've been wanting to do this for a while, and life gets in the way. My name is Ali Hassan. I'm a physician. I'm Lebanese American. I was born in Lebanon. Came here with my parents when I was just 1 year old. Migrated during the war, and then went back as a child around the age of 8. Finished high school in Lebanon and came back here for college and medical school, and here we are. That's one aspect of me. I don't like labels. I don't like to label anybody, and I don't like to label myself or claim that I'm an expert in anything. I'm a man of many curiosities and interests, and like to dabble in a lot of things and jump from one thing to another. So why don't we start with medical? What got you into the medical field? Without sounding cliche, it really was something ever since I remember being a child, a kid. I just was obsessed with science and the human body, and I just wanted, I don't remember wanting to do anything else other than a short period of time where I thought I had a shot at the NBA. But then I realized that I'm way too short for that. My vertical sucks. But being a doctor is what I've always wanted to be.
Now for me, I remember a time where I used to be at the hospital with my cousin who fought cancer and passed away. God rest his soul. It was very tough for me to face hospitals. I almost got a nausea from hospitals. You're in the ICU, which is
intensive care unit.
Is that the most critical?
It's the sickest of the sick. There's nothing sicker than that. Then that would be the morgue, because that means you failed and people died.
I mean, the thing is, people stress about work-life balance, detaching from work. I mean, people that have office jobs stress about that. How do you cope with dealing with death, life, the sickest of the sick? How do you separate? Do you separate? I mean, how does that work?
Interesting questions. You said something that when you had a family experience or somebody that was sick, and the thought of being in the hospital made you sick.
Correct.
For some reason or another, I don't know why, I can't explain it, but my first memory of being in the hospital, I loved it. I love the smell of a hospital. I know it.
Wow.
It makes people sick. They hate being there. I just loved it. I loved everything about it. I loved the chaos and the order at the same time. I love the fact that it's actually a place where you try to turn order out of chaos. It's people going with sick and failing. There's blood and bodily fluids everywhere, and you're trying to put them back together and help them and fix things. And I think I'm the only person that is okay with hospital food too. I just, it's probably because that's all I've been eating for the last 10 years. So I can't explain it. I love it. I gravitated towards it. And I'm, to be that kind of person that could live in that environment, dealing with life and death, you can't take it home with you. You can't be the kind of person that is too empathic or empathetic. It's this balance of you have to care for the other person, but not to the point where it's at your own expense and you're taking it home and it's destroying you. And I've maybe growing up in Lebanon, and war and death is part of our life. That is just it does not affect me the same way it affects.
Did you experience war and death in Lebanon?
Oh yeah,
actually being there, because I came when I was little. I didn't experience any of that.
It wasn't my first memory, but I was actually born at a time the Israeli occupation was undergoing in Lebanon, in Tyre or Sur, south of Lebanon. And there was a curfew. Nobody was allowed to go at 6 p.m. Everything shut down. The Israeli tanks were in the streets. Nobody could leave. You get arrested or shot on sight. And my mom had to be smuggled out of the house into the hospital, and the doctor had to come in and operate the hospital in the dark without letting anybody know.
Yeah. And how old were you?
Well, that's me being born.
Oh wow. Okay.
Yeah, that's when I was.
Any visual memories
of
as you were older, actually remembering?
Yeah, when I was 8 years old, within a few months, the war in 1993 broke out, and you're watching the war develop outside your house. You're literally looking in the skies. You see the helicopters and the firing and the bombing and buildings collapsing and death and I noticed that it didn't. That's gonna sound weird. It didn't scare me. It fascinated me. The destruction. Not the destruction, the chaos and the stress and life and death. I looked at it from almost from an outside perspective. Maybe that's a defense mechanism because what's the alternative is being overwhelmed and destroyed by it.
But you're young. It's surprising that you looked at it like that at that age.
I don't think it was a conscious thing. I just realized that I see other people freaking out and scared and running around, screaming and yelling, but for some reason it did not have the effect on me. And I think I carried that into my field of practice that, there's these defense mechanisms in psychology where, let's say some are healthy and some are not. You were bullied your whole life. And then you can either grow up to be a bully or you can grow up to be a mentor and learn martial arts, for example, and teach other kids how to defend themselves. Yeah. It's a defense mechanism. Some are good, some are bad.
So you think that's connected to you getting into the medical field?
I'm very, very sure it played a role. Because growing up in war, you're growing up with life and death and sickness and illness, and with that comes healing and doctors and nurses and trying to again make order out of chaos and try to fix all this.
Do you believe a lot of human beings are where they're at today because of something they've experienced in their childhood that led them to what they do today?
Absolutely. I've discussed this with a lot of people, some experts in their field and some just wise people that know a thing or two about life. And I can't find anybody that really, I'll call it an unpopular opinion of mine. I don't like to take credit or be condemned for anything that people do or achieve, because we're the product of really just two things: your DNA, your genetics. You absolutely do not choose that, and your environment, and you also don't choose that. And it's like these two main ingredients that set you on a path that it's almost predestined. This becomes a more philosophical issue, and it's of course open to debate. And it's a theory that I'm still working on and expanding. But
I always thought, how could you be negative towards somebody else's religion when I believe they were born into that religion?
Absolutely.
If I was born in a Jewish family in Israel and that's all I knew, I'm sure I'd probably be Jewish. Yeah. So how could you even have that judgment towards others when, like you said, I believe that?
Exactly.
I don't know if that's why I'm doing what I'm doing today. I can't really link it back. I'd probably need a 3-hour therapy to figure out why I'm doing what I'm doing and what that links back to. But yeah, I believe it helps people in a positive fashion because it helps you figure out your mission, but also in a negative fashion. There's some people that don't let go of those childhood demons, and sometimes it drives them to have personality traits that are not the best.
Absolutely. We all have those demons, and it really... And I think that's your demons most likely come from your environment, if you were abused, if you went through hell, if you were sick as a child. And it's also your genetics that could help you overcome them maybe and turn them into a positive. But also you need some guidance. You need a lot of the problems we have is lack of a coherent family and lack of a father figure especially. And you need that discipline. You need people to tell you that no, this is wrong, this is right, this is how you go about things, and this is how you get better. And I think that's one of the biggest problems we have with society these days. Yeah. Are we gonna go down that avenue, or are we? You said something that
I had this written out with some topics, but I said, you know what?
I threw it away. I was
flowing nice. So on that topic, I heard one thing that helps people get rid of their PTSD or their inner demons. For the people that can't let go of them, because, I believe for me, I believe I'm a strong-minded individual. I think I could take something from the past and suck out the value out of it and leave everything else and keep going. Yeah. And that's how I look at everything. And that's a blessing and a curse because, to my wife, sometimes I feel like a machine because it's not getting through because I'm just trying to focus on the next positive thing, kind of like a crack fiend. It's weird.
That's the most common problem between men and women is that we are fundamentally different. I know we live in a world now where men can be considered women, women can be considered men. There's things that are fundamental, and I'm a very science-oriented person, and even somebody can call it old-fashioned, is these old wisdoms have some truth to them.
Yeah.
There's people that are kind of marginalized, or they're outliers, but that is not the norm. That is not the majority of people.
Yeah.
Men
I don't
and
know if
women
you've
are.
seen Donald Trump's speech yesterday.
No, I did not.
That he's canceling all of that. The first day, if he's in office, he's canceling everything that has to do with more than two genders and the things they're teaching and the laws they're passing and the tax dollars.
Yeah, so this is a touchy subject, and a lot of people get canceled, get in trouble for it. I hope I don't get in trouble or canceled. Yeah. I don't want to. I want the freedom to discuss these things and not shove them down other people's throats. And I think that's what Trump and other people are doing. They're rebelling against it. Like, there's a room for it. Just don't force it on everybody.
Don't force it, and don't teach it at a young age. That's my opinion.
Don't force.
I have nothing against it. I have friends that are everything, and I've great people.
I have.
But I wouldn't be comfortable with my son getting a book in class that says you could either have a penis, a vagina, or you could take one out and put the other. Like,
Exactly. I have friends and colleagues that are gay, trans, black, white, green, yellow, every spectrum of life, and they're all amazing. It's not.
But that also links back to what we're talking about with your personality and your brain, and your mission is usually formed in your childhood.
Yeah.
So to show children this, it's going to be part of that DNA and part of that PTSD and part of what grows with them. So why would we want to do that when, if it's not broke,
and that's the problem, is that kids are growing up, they're figuring out themselves.
Yeah.
An 8-year-old boy or girl has no idea, cannot tell their feet from their head. They can't tell anything. They're growing, they're developing, and some of them might have traits that lean more feminine. Some of them might lean more masculine, and you can't just pick some of these straight and say, "Oh, you're a girl, but you're acting like a boy, so we're going to go and give you hormone blocking medicine that's going to change your life forever."
Yeah.
And undergo surgery that's going to have horrible results. When 90% of these people, these children, when they grow up and become adults, they usually go back to their assigned gender at birth.
Yeah.
It's a phase. It's evolving. What we're doing is, like, we're taking this 8-year-old kid that's going through a phase, and we are having them undergo changes that cannot be reversed, that will affect their life forever.
It seems pretty black and white to me. I don't even know how this happened to this point.
Yeah, where did all this happen? Why are we here? Why is this... there's these things that we just...
A lot of weird agendas, and I try not to focus on it, man. Honestly, I try to keep my head at my desk and keep my head at my family and my passions and friends, because I believe if I can't make a real impact besides talking on it on the show,
Yeah. You have to be aware of them, though, because you said focus on your family, and you have a beautiful boy who's, what, 2 now?
Yeah, 3 almost.
3. Yeah. But so you have to be aware of them, because it's going to influence him.
I'm aware of praying for Trump at this point to end all this chaos.
Yeah, but I mean, that comes with baggage too. Not supporting one or the other. Trump is not the best we could do either.
He's not the best.
No, and neither is Biden. And
I respect business people, and I respect the economy, and I think that benefits me directly towards my family 100%. And my house. And if who has more benefits to my household is Trump.
So would you do that at the expense of something that would benefit the nation as a whole? So if you're selecting somebody that would benefit you, because you're saying you're more business oriented, what about somebody would benefit you personally, but is hurting everyone as a whole?
It depends how they're hurting everybody as a whole. If it's morally wrong, then obviously I couldn't morally agree with them. So getting back,
I know. I told you said not to talk politics at the beginning, but it's impossible. Politics it goes into every single thing we do, but we're not focusing on politics because that's
because I don't find value in focusing on politics. It could go both ways.
It could,
I think there's more valuable topics. So there was bombs in Lebanon. You witnessed that. You've seen it as a beautiful thing, and the fact of life and death.
Yeah.
From the outside looking in.
I don't want to say
not people dying in our country being bombed.
Absolutely.
But
so it's not beautiful. I don't want people to think that I actually enjoy. I do not enjoy.
No, of course not.
Suffering and destruction.
Yeah.
But there's something that I say a lot at work now, and I notice it's not a usual thing to say. And people look, first of all, they're taken aback by it. But when I explain to it, it makes sense. When something catastrophic happens at work, let's say the worst thing could happen is somebody dying suddenly, like a code blue, when their heart stops or their breathing stops. Or let's say they just start bleeding profusely and it's chaotic and they're crashing, you need to intervene. Nobody wants that to happen. Nobody wants to see that happen to their loved one. What I tell people, usually the colleagues, the nurses, staff, is that I'm not happy that this happened, but I'm happy that I'm here because it's something that, well, first of all, it does not affect me at a visceral level negatively. And I feel like I'm in a place where I can help and make that, turn it around.
Was it gradually that this happened where you could detach so well, or was the first time kind of like you thought about it at home, the second time, third time? And
I really think it was born that way.
Okay.
Or maybe I wasn't, and it was an early defense mechanism growing up in a chaotic, war-torn country where you had to adapt this way. I'm sure it's both, probably a component of both.
Well, if you weren't a doctor, I'd say you're a sick fuck. But because you're a doctor, I appreciate your service.
Thank you.
That's a strong trait to have as a doctor because you could be at your full mental, capacity when you're inside that room.
I love that you said that because it is a fine line between, let's say, your surgeon who's cutting. I'm not a surgeon, by the way. I'm a medical doctor, but to use the surgeon because they're the people that are actually going in and cutting and making you bleed, and in a way could hurt you. But they are helping you. And if you cannot be too compassionate. You cannot be a too compassionate, empathic surgeon because you're going to be a shitty surgeon. Because the second that you're causing the little bit of necessary harm to your patient, if that's going to affect you viscerally, it's going to mess up your job. You're not going to be able to focus on what you need to do, which is requires surgical precision. Yeah. And now you're focusing too much on the emotions. Yeah. You have to you acknowledge those emotions. You know that this person is in pain, but I have to do this. This has to be done, and everything has a price. There's certain. I feel like we need these people in life. We can't all be bleeding hearts. Yeah,
and God bless the ones that do bleed hearts because they're still doing it. And they go home and they think about it.
Absolutely.
I know nurses like that as well that go home in tears for things that they witness, and that's war heroes to me because
we need this different multitudes of people, these different personality types. Yeah. We absolutely need them all. We can't just say this is better than that.
Yeah. So Trump also, I'll go back to the politics. You just took me there because Trump also mentioned vaccines. Mm-hmm. So I'd love to talk about that with you. He said he's going to cancel some of the vaccines that are messing with our children's DNAs and causing some of this stuff to happen. Is that true? They're poking our kids with vaccines that are not necessarily needed, but could mess with the DNA, production?
I like to put this whole topic of vaccines has been controversial even before COVID. And to simplify things, put them in two categories, pre and post COVID. Prior to COVID, we've had a lot of vaccines that have been tested for years and decades. Some of them are even close to 100 years old. And they are effective. They are, especially the childhood vaccines. Nobody wants to see, nobody even remembers what polio is. Polio it's a viral illness that mostly affected children. It's been around for quite some time, but it peaked somewhere early in the 20th century and it paralyzed children. I've actually, the last case of polio in the US was, I don't quote me on this, but it's probably 70, 80 years old. But the effect of it has lingered. I've actually seen old patients, people who are in their 80s now, that are still paralyzed. There's people that used to live in what we call the iron lung. I don't know if you've heard of that. The paralysis not only paralyzed the muscles in the legs, also the muscle that helps you breathe, the diaphragm. And they can't breathe on their own. So they had to lay in bed in a big metal tube that just pumped air in and out from the outside. Not like the common ventilators that we pumps in through the air through the mouth. I've seen a couple of those patients. That was a devastating disease to children. And the thing with COVID is that it affected older people more than children. I really think and thank God it wasn't, but if COVID was mainly a disease that affected children, the narrative towards the vaccine and the disease would have been different. Because children are our most precious and vulnerable thing in life. Yeah. There's people early on making, especially in Florida, making the argument that it's okay, let grandma and grandpa die in the nursing home, but don't shut down my business. I'm not saying that this is right or wrong or ethical. I'm leaning towards this is not ethical or moral. But you could see that perspective. I can at least see the perspective. But you can't make a similar argument if this disease affected children. And back to COVID vaccine.
You're saying this is where all these new vaccines came from that are not necessarily the best, or?
No, the COVID vaccine.
Okay.
That's when the COVID vaccine first
That's where it started, you're saying?
Yeah, this is where, well, I mean, there's been vaccine conspiracy theories for 20 years now, ever since, what was it? Previous Playboy mate, McCarthy,
Okay.
Jenny McCarthy, I think.
Mm-hmm.
She popularized that vaccine caused autism. And it was all based on a single research article written by a British scientist. I don't know if he was a physician or not.
Yeah.
And there was absolutely no basis to it, no medical foundation. He published it, it was fraudulent, and it just...
So you do believe in the original vaccines that they give kids growing up prior to COVID?
Yes, 100%. And it's not about belief. I don't like to use the word belief. I'm a data, evidence, science-driven person. I look at the data. I'm willing to change my mind.
Okay.
Show me the evidence.
Yeah. So how those vaccines change now? Because why is Trump talking about vaccines that are messing with DNA now?
Oh, I think he's just talking about COVID, because COVID is the only one that it doesn't.
Is that what he's talking about?
I think so. Okay. I haven't heard what he was talking about specifically.
I heard that we've added vaccines now. Other than COVID vaccines?
No, I'm not that I know of. I mean,
okay.
the childhood vaccines have been pretty much unchanged for several years. There's been a few new ones, like the...
So do you believe there's no negative effects from the COVID vaccines?
No, there is, 100%.
Yeah.
There's negative effects to everything.
Yes.
But it's always a pros and cons game. Benefit versus risk. Are we getting more benefit? And when the COVID vaccine first came out, it was effective. It was really beneficial. The very first wave, when we first got the COVID vaccine, it was preventing infection and transmission. But that's quickly changed because the virus is evolving way quicker than we can make new vaccines. And we saw that personally. Like this is something that we read about in the research, the data, and I was seeing in my day-to-day job. Because the first wave of people that would come in the hospital were nursing home patients, people in their 70s, 80s, 90s. They would come in and just die. It was just... I've written more death certificates in the last 2 years than I have in the last 10 combined. It was horrible.
Because of the vaccine?
No, because of COVID, before the vaccine.
Okay.
And then the vaccine came, and we noticed a huge change. These people, they would get COVID, or they're less likely to get it. And if they do get it, it was not as severe, and more people survived. But then it changed. Yeah. The virus changed, and now the vaccine does not prevent you from getting it, does not prevent you from transmitting it. It still lowers the impact and the severity of the illness, especially if you're older. Now the question is, what are the side effects?
Because people like dropping dead or getting heart problems, is that...
Well, that's yes, it has caused myocarditis, which is inflammation of a layer that's around the outside layer of the heart, and that is more likely to happen in younger patients, younger boys specifically, younger, healthier athletes. But the virus itself still caused... That's the thing that people miss, that you focus on the people that got the side effects from the vaccine, but what are the similar side effects from the virus itself? And there's, depending on what side effect we're talking about, the virus was still causing more side effects. Got it. It's the benefit for the vaccine, it's like a spectrum. You get little benefit if you're giving it to a 1-year-old, and a lot more benefit if you're getting to a 9-year-old. And the spectrum just goes up. But then there's the side effects. What side effects am I giving for the child? What side effects am I giving the 90-year-old? If you're 80, 90 years old, we're willing to risk the side effects because we know the benefit.
Well, Billy, my brother-in-law, he hasn't given his son any vaccines
at all.
And he's been healthy. Thank God.
He's had no vaccines, nothing.
Because in the old age, we never had vaccines, and people.
In the old age, children got polio and meningitis, and were getting. Just because...
So do you think somebody without vaccines is at risk? With no vaccines at all?
Well, it absolutely is at risk. The thing is, there's something called herd immunity. That is, that everybody's immune and the virus doesn't exist, then that unvaccinated person is unlikely to get it. But these diseases are coming back again. Yeah. We're hearing about measles and mumps and polio re-emerging in places where they have not existed. Yeah. I mean, we eradicated smallpox completely. It does not exist in the world through vaccination. Yeah. It was a horrible, deadly disease that killed lots of children.
So it's funny because this conversation is going kind of how our relationship started, with getting to know each other and then talking medical. And then we got to your adventurous side. I realized you're an adventurer. You told me that, I think you drove your motorcycle, or where'd you go?
So I'm a motorcycle fanatic. I think I'm a bit of an adrenaline junkie. No, I'm a big adrenaline junkie. That's not mince words. I love adventure and chaos and adrenaline and all that. So my goal is to just ride all over the world. And I have a very good friend of mine who's more like a brother. His name is Ahmed Haroubi. We grew up together in Lebanon, and he's here now. We bought the same motorcycle, and we drove our motorcycles from Detroit all the way to San Francisco. Wow. It was about 4,500 miles. We didn't go in a straight line. We zigzagged. We had a general
How many stops?
It's hard to tell. I mean, I don't remember. We were driving.
Did you guys like explore on the way, or you
Oh
guys
yeah. We had destinations. Yeah, it wasn't just a straight shoot.
So it was like a tour.
Oh yeah, it was, and you don't want to take the highway in those because the whole point is supposed to be an adventure, a scenic stop every now and then. Like we stopped at Death Valley and Yosemite and Zion. I think it's called Mount Zion.
You drive at night too?
Day, night. Yeah, I mean we would ride until we get tired and we
How many hours is that around?
10, 12 hours a day.
10, 12 hours driving straight in the motorcycle?
And that could be somewhere between 200 miles or 700 miles. Sometimes we're driving off-road, up and down.
Isn't that exhausting, though?
It is, yeah. No, it was exhausting. I got sick towards the end of it. I felt like I got hit with the worst flu ever because it's out of exhaustion. Yeah. Not sleeping. We were sleeping in tents. We were camping somewhere. Sometimes it was freezing. There was one night pretty sure there was wolves outside. This was somewhere in, I forgot which state. It starts blending in. I mean, it was 14 days of adventurous hell. It was amazing.
I can't imagine that because I drove to Panama in Florida before.
Yeah.
Which was like 18 hours.
In a car.
Yeah. But there was a certain point where we hit is it Smoky Mountains or somewhere where your service completely dies.
Yeah.
It was raining very hard. It was pitch black with no lights, no service. Everyone's sleeping in the car. And like that for me gave me a lot of anxiety. I never wanted to do a road trip again because of that experience, because I felt like it was looping and like it's scary if you miss something about to fall asleep. So like
it is dangerous.
And that's in a truck and you did this on a motorcycle. I can't imagine.
Well, it goes back to you said mention anxiety. I don't, and you know, some people are going to hate me for this, but I'm blessed and lucky enough that these negative stressors do not affect me viscerally. I'm aware of the risks and danger and fear, but it does not cause anxiety. I mean, it's I try to be.
I'm sorry. Define anxiety for me.
So anxiety, it's
I've heard this word a lot lately.
Yeah, I know. So I mean, there's the medical definition of it, and there's everybody has heard of it or experienced it.
Stress that lingers.
Anxiety at some time, yes, it's a response to a negative stressor. A negative stressor could be 100,000 years ago when our ancestors were fighting off a saber-toothed tiger, and your heart rate goes up and your pupils dilate for you to see better in the dark, and your muscles contract and get you ready to run away. It's an adaptive response to a stressor, and it was necessary and healthy. And people who had a quick trigger for an anxiety response, I don't want to call it anxiety response. It's an adrenaline response.
Yeah, so it wasn't even anxiety. It was
no,
just
that's
stress.
not anxiety. It becomes anxiety when the stressor goes away, when you've run away from that tiger and you're safe and calm and 2-3 days have passed. And you hear something outside in the bushes, and you still get the same response.
Okay, I'm sorry, I didn't have anxiety. I was just stressed out in that situation, and I didn't want to experience it again.
Anxiety, I think anxiety is overused. Now, you talk to anybody, say, I have anxiety. No, some people do. I don't want to undermine mental health, and it's a serious issue, but we're going about it wrong, and we're over-labeling it, and we're over-treating it. Not everything needs to be treated with medication. I'm a minimalist in my approach to medicine. I always try to take medicine away from patients if they don't need them.
Yeah. I hear it more and more, and I can't help to think sometimes, like, do you want to experience real anxiety? Sometimes I have that thought in my head, which I'm not trying to be feelingless or like, I get it. People struggle differently with problems and cope differently. But my thing is there's real issues out there that could cause real anxiety, real PTSD. Veterans, seeing people blowing up, you witnessing war, dealing with death. You have anxiety because you're on the telephone all day and you can't originate mortgages and you need or like you have anxiety because your sister and you got into a fight or your friend and you stopped talking. Like people are using that term for smaller things that I don't think are nowhere near the level of how anxiety even started.
Absolutely. You hit the nail on the head. It's not, I don't like to call it anxiety. It's a stress response. It's a normal stress response. It's called being human, having emotions. Yeah. You get in a fight with your wife and the same day you lose your job, you're going to be freaking the fuck out. Yeah. That's normal. That is called being human. Yeah. It becomes a problem if 3 months down the road, you're still anxious and thinking about it when it's not even there. That is maladaptive. That is now hurting you.
But also what you focus on, you find. So the more you focus and say, I have anxiety, the more you're going to believe it, the more it's going to become a thing.
And then you go see a clinician or a trained medical professional and they confirm it. And that's me criticizing some of my colleagues too, that we over-treat it, we over-label it, we over-diagnose it. And then we're giving medication for it. And guess what? These medications, like Xanax, they are unbelievably effective. They are so effective. You can have people having one of the worst panic attacks. They're being vulgar and aggressive.
Yeah.
You give them that and it stops. And that's what makes it so addictive.
Yeah. But then you depend on those things, and those things cause other things.
Yeah.
You know, I watched, it started, I think, Nine Perfect Strangers is what it's called, but it was a show about maybe 10 different individuals. They all had shit that happened in their life. Did you watch it? I think I told you to watch it before.
One where
10 strangers go to like a resort. They get microdosed. They all have crazy shit between somebody that lost their son, somebody that did this, and they're all like, they're not in a normal state when they go there. They really need help, and they try this experiment out where they go, and it's based on true research, of course. And they do all of them with mushrooms, except one couple that's having a lot of struggling things. They do MDMA. They do what is it, ecstasy, Molly, whatever it's called, and it heals them slowly. And they filmed the whole show was based off of that. And that show made me start watching Netflix documentaries and things like that.
Did you watch How to Change Your Mind?
Yes, I watched How to Change Your Mind. I also watched a movie based off of when they dose people in asylum or a prison. It was based off a true story. And in this thing, it said the CIA or FBI got involved. They shut it down.
Oh yeah, MK Ultra.
Well, first off, do you believe that for people with severe PTSD or anxiety, that mushrooms could be a solution? It's way better than all this bullshit we're giving them.
I'm going to adjust this is one of, you got me excited. This is one of my, one of my favorite topics. One of the things that I'm actually passionate about. And just a quick introduction, because some people may not know what microdosing is. We're talking about psychedelics or substances, whether natural or synthetic, that have an effect on your emotional state, your psyche. They don't necessarily all cause hallucinations. And this is a very tricky, sensitive subject to talk about because most of these substances are illegal, whether wrongfully so or not. But there's been a tremendous amount of legitimate medical research done at some of the most prestigious facilities, proving the tremendous effect that they have. Okay. So, what was your question?
Well, first, if there was all this research and we see proven results, why are we shutting it down is my question.
So, we're not shutting it down now. We shut it down back in the 70s with the war on drugs. This started, so there's in the 50s and 60s. LSD was discovered earlier than that by a Swedish chemist. And it changed the world. It opened up people's minds to something that they had not seen before. Ancient civilizations, especially in South America, have been experimenting with naturally psychedelic substances. Mushrooms is one of them. There's peyote. It's like a cactus that has a strong psychedelic in it. There's poisonous frogs. There's these. I think they're called poison arrow frogs or something. They're little tiny frogs that grow in the Amazon. And they secrete this toxin on their skin, but the natives in the Amazon have learned that if you take that and you smoke it, you can have a psychedelic or a spiritual experience. Yeah. And these things, there people have been using them for thousands of years for a spiritual, religious experience. That's where the shamanism came from. These people were healers, and they helped heal your soul and body. And the West discovered them kind of late in the 50s and 60s. It went out of control. There was a famous psychologist in Harvard that his name escapes me now, but he became somewhat of a guru, and he abused this newfound knowledge and wisdom. And the war on terror was starting with Nixon, and it all got shut down. There was so much research going on at that time. It all stopped, all of it. At the same time, the CIA was experimenting with LSD. They were giving people acid without them knowing, and just watching their behavior and how they act. They thought that LSD would make people open up and they can help them in espionage and gathering information, which it doesn't. You're not just going to give somebody a tab and they're going to spill their beans. That's not how it works. So anyway, the government shut it down. Decades passed, and I think the late 90s, early 2000s, some researchers started going back to all this studies that were done, and they realized that we were onto something. There was some tremendous benefit. So they started doing research again the legitimate way. The first research that was done, I believe it was in Harvard, was done on people who had terminal diagnosis with cancer, people who have had 6 months to live. Whether you get treatment or not, you have a very aggressive type of cancer, and you're going to die. And you can imagine what kind of state of mind you would be if I tell you that. Like you have advanced cancer, even with the best medicine that we have, you don't have more than 6 months. And it's called stress anxiety. And that could be devastating. And they, I think they studied about 70 to 80 people, and they gave them, I don't remember the substance. It was either psilocybin, which is the active ingredient in magic mushrooms, or LSD. And they all had an unbelievably responsive response to it. And their outlook on life and death changed for good.
Yeah.
Completely changed. They made them accept it. When you can't change your reality, it's better to change your perception of it. You are going to die. There's nothing we can do. You can sit here and freak out and panic for the rest of your short life, or you can have a positive response to it and learn how to adapt to this and see the beauty in it.
Yeah.
Because we're all going to die eventually.
Yeah.
And that was the first research that started.
So what it really does is it shifts your perspective, you're saying?
It does.
Because I heard for some people that have major PTSD and veterans they've studied with, that they do come out of it more positive, and it releases their PTSD and their inner anxiety and their triggers. Most importantly, it gets rid of those triggers that make you act the way you act.
Yeah, 100%. The way they work is really fascinating. And we don't understand exactly how they work inside the brain because we don't even understand.
Any negative effects, by the way? Could you overdose on mushrooms?
You can't die from them. There's side effects. There's some people that could have. There's certain people that should never try it. People who have schizophrenia, for example, or have a history of psychotic breakdowns. It could trigger that. Yeah. It won't cause it, but it could trigger it. Or
but if you don't have any of that, it's totally.
They're safer than Tylenol.
Wow.
I've seen a lot of people die from Tylenol overdose.
Yeah.
It is impossible to die from a lot of these psychedelics.
Got it. Same thing for MDMA?
MDMA is in a different category. It is similar to these chemicals. They're very complex. Yeah. MDMA.
Are they being used right now in the medical field at all?
I cannot prescribe it, for example. They're being used in research, and they're still labeled as illegal. They're controlled substances.
Are they labeled as illegal because they're scared that people are going to take advantage of them and it's going to turn into?
Well, they're illegal because we labeled them illegal in the 60s and 70s.
Do you see that changing?
It is changing. It's going to be changing very soon, within the next couple of years, for example.
Wow.
I mean, we see
it's going to be like the next marijuana wave.
Yeah, but I think there's more benefits to mental health to psilocybin and MDMA and LSD than there is to marijuana. Yeah. There isn't that much. Marijuana helps you calm down. It helps with pain. And
somebody told me that they called the mushrooms the CEO drug, and I said, "What do you mean?" And they said CEOs that run big organizations,
microdosing.
They microdose and it keeps them level.
Yeah, a lot of people are doing it. I mean, they're safer than any antidepressant. You overdose on any antidepressant or Xanax or anxiety medicine, there's a good chance that they could kill you or cause permanent harm. These things do not. You cannot overdose on them to the point that they would kill you. Yeah. And there's a tremendous benefit for. We talked about people who had terminal diagnosis that are going to die. It's also been proven to be better than anything we have at the moment for PTSD, for severe depression, for severe anxiety, for addiction of any kind. It's impossible to get addicted to these substances.
Yeah. So you recommend people that do have major PTSD should try mushrooms if they don't have.
I don't recommend people do anything illegal. Yeah. When they become available, and they're prescribed under the supervision of a person who knows.
If you're in Michigan, you could go to Ann Arbor. They decriminalize.
They decriminalize it, but it's still decriminalization doesn't mean it's legal technically. Yeah. And again, this is where it gets. This is where we know that these things are good and safe, but the law says that it's illegal, and I will never tell people to go do anything that's illegal.
Of course, yeah.
But if we just they are.
But you see in the near future that you could get literally mushroom capsules from your doctor.
100%. Yeah. With the guidance of the doctor, because
the shit they're giving is crazier anyways.
Yeah.
They're giving sleeping pills to people with stress.
We give Xanax to everybody. We Zoloft and Xanax and all these things. The anxiety medicine works too well to the point that they're very addicting. The antidepressants, they don't work that well. They work for some people. The benefit is minimal.
Do you think I'm being when you say that it works so well, do you think that is why we haven't legalized it yet? Because it takes away money from all the medical sales and the pharmaceuticals?
Well, okay, now we're
going... And it heals people? Do you think it's a conspiracy? Is that a conspiracy?
Well, I was going to say, now we're going into conspiracy...
well, no, I don't know what to believe. It's an idea in my head that we make so much money off the medical industry is that why we're stopping this stuff that could heal people for good?
That's a component of it. You touch on a very important thing. I think we spend about $20 billion a year on antidepressants and anti-anxiety medicine. And if you have depression, you're going to take the pill every day. A lot of people take them for years and decades or for the rest of their lives. The thing with these psychedelics, people take them usually once, and it induces this religious, spiritual experience that heals you. If done right, if done on the right supervision and the right circumstance, and the right environment, with the help of somebody who knows what the hell they're doing, one session could have life lasting effects. And yeah, there's no money in that. So there are going to be some lobbyists and companies that are going to fight it, but I see a movement that's growing, and it's not going to be stopped. People are becoming more aware of it, more accepting.
Yeah.
And I see the way to make it legal and to change people who are more conservative about it is the benefits that it's done for veterans and PTSD.
Yeah.
That's how you're going to get people who are more conservative, Republicans, to military people, that they've suffered enough sacrificing for this country. They've given us a lot, and we have something that could heal them and help them get back to a normal life in society.
Better than a vacation, going 3-4 days to a psychedelic retreat and healing yourself.
Yeah. The benefit is,
instead of going to asylum, take them to a medical retreat.
And that's what we do, because I see people, even though I'm not a psychiatrist, but I deal with a lot of people who have attempted suicide, because a lot of them come to the ICU first. We have to monitor them there, and we patch them up, we put a Band-Aid on it, and then we send them home without fixing the problem.
Yeah.
And we don't have a good solution. In these new types of substances, they're not new. They've been around for millions of years. We're just now rediscovering them.
Yeah. What's the one called? Ayahuasca?
Ayahuasca?
Ayahuasca.
Yeah.
What's that?
So ayahuasca, it's a substance. So
is that even found here? Could you find it in U.S. or is it in other countries?
It's found in a lot of plants, a lot of trees. I'm sure it'll be found somewhere in the U.S. We have every type of thing that grows everywhere.
Yeah.
But it is mostly found in the Amazon. And it's amazing how this was discovered thousands of years ago, because ayahuasca, the equivalent to it is DMT. Some people have probably heard of DMT. But it is one of the strongest psychedelics.
DMT is the one that gives you the near-death experience? Is that DMT where it kind of...
It does, but a lot of things do give you... DMT is one of the strongest psychedelics there. DMT is usually inhaled, it's smoked, and it could almost replace the reality that you're living in. It's short acting, and it could... Everybody has a different experience.
Where does that come from?
From the plant. Ayahuasca and DMT are
similar.
They're kind of equivalent or similar. The thing with ayahuasca is it's a plant. It's found in plants. It's usually brewed as a tea, but you need another chemical to be taken with it, because if you just take the ayahuasca on itself, the acid in your stomach will disable it.
Yeah.
You take it. It's amazing that these shamans thousands of years ago figured out I'm sure they weren't doing biochemistry, but they figured out that you have to take this plant with this plant for it to be effective. DMT is that extracted and crystallized and then smoked, because when you smoke it goes straight into the blood and then to the brain. When you eat it goes down to your stomach. You have to metabolize it.
There's one more I heard about that makes you throw up and shit all day.
That's the ayahuasca.
Oh, that's the same one?
Yeah, so you
and that's good for you because it kills all the bad cells in your body.
Well, no, I mean that's
because I wouldn't want to do that.
No, it's not. This whole killing bad cells and detoxing, that's a myth. That's something that a lot of health companies try to sell you. That you don't need a detox, and that's a whole different topic.
Well, that's another topic. Have you watched Limitless on?
Yeah.
Oh, you have?
Yeah, I love that movie.
Yeah. No, not the movie. I love the movie too. There's a show called Limitless.
No, I haven't. But
what's his name? Tron, is that his name? The guy with the big hammer, the Disney.
Thor.
Yeah,
he's in it.
He's in it.
Okay.
He travels the world and does extravagant things. He swam in the Antarctic for a period of time. He climbed like a 300-foot rope off a helicopter. He walked out. He's doing crazy things, right? He did a 4-day fast.
Okay.
4-day fast, and he had to swordfish for his food.
Is this like a documentary or?
It's a document. Cameras follow him around, and he goes through these crazy challenges.
It's not
crazy challenges that make you a superhuman, pretty much, to live longer. And they were saying that the fast after the 3 days of fasting, they were showing how it kills all your negative cells inside, and it gives you some tremendous effect. And that it should be done like every quarter.
So there's tremendous benefit to fasting. Yeah, and a lot of people now are discovering.
Well, I know as Muslims, we have the fast or Ramadan, but it's saying that the actual best effects are not given until the full 3 days.
I'm not sure. I don't know about much about that, but there's benefits to fasting.
Yeah,
we are not designed to eat all day every day. We evolved surviving in the African savannah, going days sometimes without food and running hundreds of miles until we find food, we eat a lot, and then we fast again. This is how we evolved.
Yeah.
And now we live in a world where we can have a feast 7 times a day. There's a McDonald's around every corner, and that's hurting us. Yeah. So there absolutely is a benefit to fasting, whether it's a day or 2 or 3. Limiting your caloric intake and not eating like a glutton definitely has benefits. Yeah. We can all agree on that.
I think you'd like it. You need to watch it.
I will. It's on my ever-growing list of things
it has
to watch.
8 or 9 episodes of different things he does to extend his life. I'll tell you, the ice baths, knock on wood, but I feel like even when my wife has been sick and I've slept by her, drank out of the same cup, I feel like the ice bath has really stopped me.
Yes.
And I've been doing it every day now for over a year.
Every day? You plunge in?
It was cold showers last year. Yeah. This year I bought the plunge.
Yeah.
And when the plunge freezes outside and I can't get in it, I fill up the bathtub upstairs with ice. But it's been an amazing life changer, really.
So that's something I've recently started doing with, but I'm only doing cold showers. The benefit for taking
cold shower is actually tougher, to be honest. This one, it's quick. You get your whole body in, then you deal with the shock. The cold shower, you can't feel your hair.
To do it slowly. You have to get it on your back and the front.
Yeah, you have to keep covering your body,
like,
so it's tougher.
You do it several times. It takes your breath away.
This one's a faster shock.
I want to do that. I want to get a...
well, I got it out there. It's frozen.
It's just a bear.
Should we take the camera and
right
follow
now,
us outside?
I'm not ready for it. But I will. It's definitely on my...
Or we could jump in that pond out there.
Don't tempt me. I'm thinking about it. No, there's a tremendous one. There's a lot of simple things that you could do just to live longer and healthier. There's the basics that your parents and your grandparents and everybody before them: eat well, sleep well, don't smoke, exercise, moving, being healthy, and then fasting, limiting calories. You actually live longer. There's been so many studies on limiting caloric intake. They've done it on rats and animals and humans, that the less you eat, the longer you live. Of course, you're not gonna, don't starve yourself and lose weight. And the new thing that we're discovering now is that cold exposure, short cold exposure. You don't want to be living in a cold environment constantly. That could make you sick. Chronic, that's the thing. Why is it that this is beneficial?
I just do 3 minutes. That's fine, right?
Right, but why is it beneficial? Why is plunging in an ice cold bath for a few minutes, why is that beneficial? But when you are exposed to constant cold all the time, why is that harmful? There's 2 parts. There's the psychological part, because you feel better after. When I take a cold shower, you get this burst of tremendous energy that just lasts all day. It's because you are choosing to do it. You're doing it at your own device, and you're accepting it. Exposure to a stressor when you are in control is unbelievably helpful. And it helps you become more resistant when you're exposed to stressors later in life. Or later in the day when you have no control over them. It's like, you know what? I know this feeling, this sudden surge of adrenaline that takes your breath away and makes your heart race. I'm used to it. I do it every morning when I plunge in an ice cold bath. Yeah. And now when it happens because I heard bad news or got in a car accident or I'm in pain, I've been through this. I can handle it. So it trains you mentally. The other thing is that it's a short burst of adrenaline and then cortisol, which is the stress hormone. In the short bursts, those are helpful. It's becomes detrimental to your health when it's every day, constantly, all the time. If I put you outside in the cold every day, you're going to get sick and die eventually. It's going to wear you out. It's these short, controlled bursts of these stress responses that are beneficial. You don't want to do it every day. Or you don't want to do it constantly all day.
When this guy in that show Limitless swam across the Antarctic, they did things to calm his body down slowly so he doesn't collapse or anything from being in the cold for so long.
Yeah, it's a fine balance.
Yeah. Well, it's a lot of great stuff, man. Thank you for coming out on the show today.
Thank you.
We do want to bring you back with, one of the most popular conspiracy theorists we know.
Oh, I love a good conspiracy theory.
He wants to come out here and he wants challenge you on a few topics that are more controversial.
I'm ready.
But today I think it was a helpful episode. We do call it Shotcast. If you had to give, one shot of inspiration, one shot of value to everybody listening, if you were talking to your young self, what's one thing you tell everybody out there that can help them in this life?
A shot of inspiration. We're living in a world that is seemingly getting worse and worse, and there's so much negativity and division. If you just take a step back and realize that all the great things that we have around us, we live actually in a beautiful, beautiful world. We're lucky, first of all, to have each other and have our health and have our families. And I know not everybody has that. We live in a place where there's a lot of opportunity. We've achieved so much. We have the potential to accomplish even more. And as humans, as a species, we've been through wars and we've always come out the other side victorious. No matter how stressful things are, believe in yourself, believe in what you can do, believe in how good there still is in the world. And whatever it is you're going through, we'll get through this.
I love it, man. Thanks for being on the show, Dr. Ali Hassan, ladies and gentlemen. Thank you.
Thank you.